Okay, let's talk about jaw pain. For millions of people, it starts as something small, a little click, a pop, maybe a dull ache you barely notice. But then it doesn't go away. Soon that pain becomes this constant, unwelcome guest that messes with eating, talking, even sleeping. Today, we're going to break down the super frustrating and often misunderstood world of temporomandibular disorder.
Does any of this sound a little too familiar? Maybe you wake up with a headache that just seems to appear out of nowhere, or there's that clicking sound every single time you chew. You might have even gone to the dentist, gotten a mouth guard, and followed all the rules, but the pain, it's just still there. If that sounds like you, I want to be crystal clear about something. You are not imagining it. This isn't just a little bit of soreness. For so many people, this turns into a chronic condition that genuinely gets in the way of their life. And figuring out what's really going on is the very first step to getting that control back. So the official name for all these issues is temporomandibular disorder, or just TMD. Now, it's not one single disease. Think of it more like an umbrella term for a bunch of conditions that affect the jaw joint, that's the TMJ, and, this is key, the powerful muscles you use to chew, also known as the muscles of mastication. So what does this actually feel like? Well, the pain can be sharp, or it can be this constant dull ache that spreads out to your ear, your face, or even your neck. You might hear clicks or pops coming from the joint. Sometimes it can even feel like your jaw is getting stuck or you just can't open your mouth all the way. And those non-stop headaches, yep, a very, very common symptom. But to really get a handle on why this pain is happening, we kind of need to look under the hood at the amazing, intricate machinery of your jaw. So let's explore the anatomy of the ache. Probably the easiest way to picture your jaw joint is to imagine this tiny little disc tucked right between the bones. Its whole job is to be a smooth, gliding shock absorber. It soaks up all the stress and lets your jaw move fluidly every time you open, close, or slide it from side to side. It's a tiny part doing a huge job. And this is what makes your jaw joint so different from other joints in your body. See, unlike your knee, which is covered in that slick, smooth cartilage, your jaw joint surfaces are covered in this much tougher, dense, fibrous tissue. This unique setup, along with that super important disc, is built to handle incredible force, but it's also what makes it vulnerable to some very specific kinds of problems. So what is it that throws this whole complex system out of whack? For decades, we thought we had a pretty simple answer, but we've learned the real story is, well, it's a lot more complicated. The cause is way more than just a bad bite. Yeah, our understanding has really changed over the years. Way back in the 1930s, everyone pointed the finger at dental issues, like missing teeth. Then we started looking at trauma. This could be macrotrauma, think a direct hit to the jaw or whiplash, or it could be microtrauma, that's slow, steady damage from clenching or grinding your teeth night after night. But today, we know that for most people, it's not just one thing. It's usually a combination of factors. And this quote from a major review paper just hits the nail on the head. It says the cause is multifactorial. That's a fancy way of saying it has many potential causes. And that is what makes it so incredibly tricky for both patients and doctors to figure out and treat effectively. Okay, so if the cause is complex, what about the solution? Let's talk about the first steps to relief. Think of it like climbing a treatment ladder. The first few rungs on that ladder are almost always conservative, non-invasive things. It all starts with education, learning simple stuff like avoiding super chewy foods or not yawning too wide. Then you've got physical therapies like gentle jaw exercises and heat packs. And, of course, there are oral splints or mouth guards, which are one of the most common treatments dentists recommend. But, and this is really important, we have to have realistic expectations. The research is pretty clear. While these splints can give a lot of people some real short-term pain relief, there's actually very little evidence that they work as a long-term fix. And for many people with persistent pain, this is where the journey starts to get really frustrating. So what happens when you've climbed those first few rungs and you're still in pain? Well, this is when we need to start looking beyond the dentist chair and into the world of interventional pain management. See, when the pain is mostly coming from those overworked chewing muscles, a condition we call myogenic, TMD, pain specialists can switch gears. Instead of general approaches, they can use highly targeted therapies that go right to the source of the problem, the muscles themselves. This visual really helps demystify one of the most effective treatments by showing you exactly where it goes. These are typical spots for injecting botulinum toxin, which you probably know better as Botox. By putting it directly into those tight trigger points in the big chewing muscles, the goal is pretty simple:
to get the muscle to relax and stop spasming, which can finally break that cycle of pain.
And the evidence backs this up. For instance, in one study with 46 patients dealing with chronic pain, about 60% of them had at least a 50% improvement in their pain, their ability to open their jaw, and how tender those muscles felt. So the bottom line is, for the right patient with stubborn, muscle-related pain, this can be a real game changer.
And botulinum toxin isn't the only tool in the specialist toolkit. They might use steroid injections right into the joint to cool down inflammation, or trigger point injections with a numbing agent to release those tight muscle knots. They can even use nerve blocks, which are great for both figuring out where the pain is coming from and providing some much-needed relief. So the really crucial point here is this. Managing complex TMD is rarely a one-person job. It almost always takes a team, a multidisciplinary team. We're talking about your dentist, a physical therapist, and maybe a pain management specialist, all collaborating and working together on your specific case. All right, so let's bring all this home. What does this all mean for you? Let's talk about your path forward. If you only take one thing away from our chat today, let it be this. If your jaw pain just isn't getting better with the first-line treatments, it's probably because the problem is more complex than just your bite or a bit of grinding. And a complex problem needs a more comprehensive solution. And that leads us to the final and maybe the most empowering question. If you feel like you're just stuck in this cycle of pain, maybe it's time to look beyond the usual first steps. Think about talking to your doctor. Ask them if getting a referral to a pain specialist for a full multidisciplinary assessment might be the right next move for you.